that you should be asking but may not be asking. The show that brings you the information so that you can be enabled to make more informed decisions for both you and your family. Happy to have you here with us today at Dedicated Senior Medical Center. We have Brian, Andrea, and Christine with us, and they're going to share with you some information that you did not know about. So Brian, what is Dedicated Senior Medical Center?
Well, Maggie, Dedicated Senior Medical Center is a family-owned primary and specialty care practice committed to delivering superior health care to Medicare-eligible seniors, and we provide coordinated primary and preventive care all in one place.
All in one place. So everything is right here.
Yes, ma'am.
That's awesome. That's awesome. So I noticed how the setup is. You guys give VIP care at this location. How many locations do you guys have?
Well, Maggie, we are expanding, and we are in 12 states now. We have about 100 medical centers across those 12 states right now.
Oh, wow. And how long have you been in existence?
A little over 30 years, mostly in South Florida, but recent expansion. We believe in this model so much, we needed to take it out to the rest of the country, and so that's why we're expanding as we are. And in Orlando here, this is our 4th center. We're opening Fairview Shores.
Okay. Now, with the kind of assistance that you guys are providing, I'm assuming that the waiting time in the lobby would be a little longer. So what's the average waiting time period for a resident before they see a doctor?
Well, the average waiting time is no more than 15 minutes. It can be even less. And we can achieve this with a great teamwork. Or front desk works together with the rest of the team to streamline the process of checking the patients in. We don't have magazines in the waiting room. We just call it actually welcome room, because they don't have time to read.
Okay, because they're just that short.
Exactly.
Okay. So with the way that is set up, can a patient just walk in if they're not feeling well?
Yes, they can. If they don't feel well, they can call anytime, and we'll have a spot for them as a walk-in. We always make sure that we have little spots for walk-ins because we work with seniors, so they can feel something anytime. So during regular hours, they can call anytime, and they are welcome.
Okay, what are your regular hours?
Monday through Friday, 9 to 5, 7:30 to 5.
7:30 to 5.
Yes.
Okay, all right.
7:30.
So Monday through Friday, 7:30 to 5.
Exactly.
So what happens on the weekend if a resident needs help?
They can call the center number. It's a 24/7 number that they can call anytime.
Okay.
So we're always going to have somebody in line to talk with them and guide them through to check what they are feeling, if it's necessary to go to the hospital or not. Because sometimes they feel bad and they just run to an ER or a hospital. And what we tell them as soon as they become a patient is call us first. Because
And Maggie, one of the things we want to do as a company is we want to keep our seniors out of the hospital because that's the worst place for them.
Yes.
And we also, in addition to that, our primary care providers provide their individual cell phones to all of their patients. So a patient can call their doctor's cell phone at any time of the day or night to talk to their doctor if they're concerned.
Oh, who does that?
Just us.
Yes.
Wow. That's amazing. That is truly amazing. Wow. Well, thank you for what you guys are doing. With COVID, a lot of things change. There are some people that do not feel comfortable with leaving their house. How are you guys able to have doctor visits with those people? Oh, are you guys able to have doctor visits?
Yes, we actually can communicate with the patients who are staying at home through video visits. If they have a smartphone, we can actually set up a virtual visit.
Okay.
yeah, we use telehealth.
You use telehealth? And
During the COVID, the pandemic, it was very necessary, and that's how we monitor our patients during this.
And when the pandemic hit, we had to pivot very quickly to telehealth. And we're a really high-tech company at Dedicated, and we created our own software in-house very quickly to be able to do telehealth that quickly, because when the pandemic hit, everything closed down, as you know.
Mhm.
And so we still need to take care of our patients. And so they can't come in, then we have to come to them. And so that's what we did.
Oh, wow. Man, you guys covered everything. Wow. So, okay, so for those that don't mind leaving their house, okay, to get here, but they don't have transportation, is there a way that you guys help with in that area?
Yes, we provide free transportation for the patients, cost-free for them, private transportation,
Okay.
not a van or something like this. So any patient that doesn't have transportation, don't drive, they will not miss their appointment because of this.
Okay, okay, okay.
Door-to-door transportation.
All right. And what's my mom, when she has to go to a doctor's office, she sits there and wait and wait and wait. Sometimes it's over an hour. She's just waiting and waiting. So is your transportation service different from the one that my mom was receiving?
Yes, it's very different. The waiting time to be picked up from their home, it's usually 10-15 minutes from the time we order it from the front desk. And once they are finished with their visit here, they don't have to sit here for an hour. They actually sit here probably for 10-15 minutes again.
Oh, wow. There's no way.
Yeah.
So, wow, it takes that short a time to process a patient. Wow.
And that's part, and Maggie, that's part of what part of our core model is VIP service. And that's part of our VIP service offering is we don't think you should wait long. We think you should get here safely and consistently, and we really want that for our seniors.
Now, earlier, Brian, you stated that this facility offers a lot to their clients, to their patients. So when a patient comes here, do they have access to a pharmacy? Or do they have to go back out to pick up their prescriptions? How does that work?
We provide prescription medication on site. We provide lab work on site. They do all their lab work here. We provide x-rays on site. We even have cardiology on site. And we do EKG, echoes, everything. So we try to accomplish the main things so they don't need to be running around and waiting to be seen in a lab, in a laboratory or anything like this. So we try to
Wow.
accommodate everything.
You're not kidding. This
Yes,
is
we
VIP.
do.
Wow. One thing that I do know is that every time a patient or an individual have to go to one of those places, they have to fill their paperwork all over again.
Exactly.
And so for here, the fact that everything is here, wow.
Yeah. And Maggie, one thing we also do is we bring in specialties into the center here. So when we say we want coordinated care in one location, we mean that. They can get everything they need here, their primary visits, their specialty visits, their medications, their x-rays, their blood work, because we want them coming here and then going home. We don't want them going all over town to different appointments, taking up a lot of time and potentially, exposing themselves to get sick again.
You're right.
So, that's part of our plan here is to take care of everybody in one stop shop and save that time for them, that hassle.
Yeah, yeah.
And another huge thing is we have an in-house referral specialist who actually helps the seniors with getting authorizations if they need some kind of test from the insurance company. Also, our referral specialist, Carla, she books their appointment at the specialist office and makes sure we get the results back quickly. So our primary care doctor actually knows what's going on, what kind of medication they are prescribed at the specialist office.
Okay.
Yeah.
That's amazing. Okay, so we have in our community, we have something called language barriers, which we all know of. We have, and because of language barriers, some people tend not to go to the doctor unless they have someone that can translate for them. Do you guys have help in that area?
We do. As a matter of fact, our entire staff is very diverse. We can speak a lot of different languages within the staff here.
Okay.
And we have to do that because that's what our population needs. So it's not just one language, it's not just two languages. We have to be able to communicate in all of them. So we try to hire a diverse staff here that can do that, that cares for the patients like we want. And if we don't, then we also have a translation service. So we have, again, the technology to translate for the doctor right there in the room using a tablet.
Okay, wow. So is there something that you guys did not cover? No. Not from
that
what
I
I'm
can
saying.
think of.
This is amazing. Wow, this is truly amazing. You guys are good. I thank you for what you're doing. I honestly do. I wish I knew about you guys a couple years ago. You know, when my dad passed, I don't think that he would have passed that way, you know, because everything was on my shoulders. Had I known about your services, it would have helped me a lot, you know. So thank you for the next person, you know, that you guys will be helping. For someone who's been with their doctors for years and years and are not really willing to leave their doctors, what would you say, or how would you talk to that person based on what you guys offer for them to leave their doctors? What would make you guys qualify to offer something better than what their doctors offer?
I think that all the convenience that we offer to the patient is a big deal.
I agree.
You understand?
Yeah.
I understand the bond that we have with the doctors, and our doctors, they do have this with our patients too, but we offer so much more that I think that a patient needs to consider themselves first. You know, like doing everything in one place.
Yeah.
We have a whole team. It's not only one doctor, but the whole team is dedicated to provide the VIP service that the patients need. You know, from the front to the back, all of us, we understand the mission, the vision, and we have love, accountability, and passion. These are our core values. And we need to understand. If we don't understand this, we can't be here.
Oh yes, I agree.
You know?
I agree.
And most of the time, the seniors, they see their doctors once in every 3 months or 6 months, because their primary care providers have lots of patients, and they don't have time to give them more frequent appointments. Here, we like to bring in our patients at least once a month, and many diseases cannot wait 3 or 6 months to be detected. Since we see them once a month or even more if they have those kind of conditions, we can keep our eyes on what's going on with the seniors, because 3 or 6 months can be way too long.
You're right.
Yeah, that's a great point, Andrea. And you know, Maggie, that one thing we pride ourselves on is the time we spend with our patients. And you know, our mission says that we honor seniors with affordable VIP care that delivers better health. The way we deliver that better health is we stay in touch with our patients. We see them, like Andrea said, once a month. But here's another thing. Our doctors are only allowed to have about 450 patients in a panel. Now, if you don't know this, typically medical practice, a doctor has to have 2,000 to 3,000 patients to even become profitable. So our doctors can only have 450. That's because we want the doctors to spend the right amount of time with their patients so they can detect and manage those high-risk diseases. And we always say around here, we always say we want our seniors healthy, happy, and at home. And that's our goal.
Wow. Oh man, I wish I knew about you guys. Actually, this is gonna bring tears to my eyes, but you know, I wish I knew. Wow, that's awesome. And preventive care, we know, is always best. You know, so thank you guys. There are some people that are watching this, you know, whether they're seniors or not, or about to be seniors, and they do not know what kind of help is available to them once they turn 65. What would your advice be for those that are watching that are about to turn 65 or may have already turned 65 and don't know what's available to them?
Okay, step number 1, come into our center. Okay, come and visit one of our centers. We have 4 in the Orlando area. This one's Fairview Shores. This is our most recent office that we opened. But come into our center. We'll give you a tour of our center. We'll show you the center. We'll let you meet the teams that will take care of you. And you can see how we operate during the day. And once you come in to see that, if you need help determining what benefits are best for you, what Medicare plans are right for you, we have contacts in the field that can help you determine what Medicare plan is best for you. They can get you in the right plan that's best for your situation, and then that allows us to be able to take care of the patient like they need to be taken care of.
Did you hear them? Come on in. That is wonderful. You guys, thank you so much. Thank you so much for what you do. Dedicated Seniors Medical Center truly is dedicated to the people. So with that being said, you heard it here. Come to Dedicated Senior Medical Center. You may be a senior or you may be just a family member. Either way, they can help. They'll guide you as to what you need to know and how you need to go about doing it. So come, they're waiting. Until next time on Don't Ask, Don't Tell, have a wonderful day.
We are here at Dedicated Senior Medical Center in Fairview Shores, about ready to show you what the inside looks like and what you can experience as a patient here. Welcome into Dedicated Senior Medical Center. We are taking a quick tour to see the center and how it operates. And our first room is what we call our lobby area. And this is where patients come and they get checked in to the front desk here. They can get some snacks or drinks to the side here. They check in for the front desk, and they have a seat for a brief few minutes as they wait for the medical assistant to come bring them into the room. And as we move through the lobby, you can see that we have lots of great team members working feverishly to provide a VIP service to all of our patients here at Dedicated. And as we roll over to this room over here, this is our healthy living room. And this is a room where we have activities for our seniors. We do Tai Chi, we do exercise, we do bingo, we have birthday parties, and we do lots of celebrations for our patients right here in that room. Now we're going to step on back to the back. The doctor is ready to see you. We go right through this door. And inside, this is where all the magic happens. This is where the patients enter. They come in over here for a weight and a height check every time they come in. We have restrooms that are connected to a lab in case they need to deposit specimens for us. And then as we move around down the hall, in this direction we have our specialty area. So all our specialty doctors will be down here, cardiologists, podiatrists, acupuncturists, and they'll see patients in this area for those services. And then as we move around to this area, this is our blood draw area. So if we need to do any labs with any patients, we draw their blood here. And then off to the right, this is what we call our medication room. And this is where we have hundreds of generic medications. They can stop, get their medications on the way out, and take it home with them. Over to my left is our lab area. This is where we collect our specimens. We prepare the labs to be sent out, all in one stop. And as we move through the center, you'll see down this hallway we have an x-ray room. If we need to do any x-rays, all that can be done in-house. Patients do not have to go outside of this building to get an x-ray. Our care supervisor's office is right here, and that care supervisor maintains the patient flow of the office as the patients are coming in and out in a timely fashion. Our medical assistants will be sitting here in these spots. We have patient rooms down each hallway. We have 5 patient rooms down this hallway and 5 patient rooms down every hallway. And as we move further into the center, these are where our primary care physicians will office. We have enough for 4 on this side and 4 on this side. Our center can hold 8 physicians and about 3,200 patients. And as we move through the center, you can see we have lots of room for expansion, for more medical assistants, more patient rooms down each hallway. We have some areas that our employees can enjoy. We have restrooms. We have a staff lounge as well. And this is our staff lounge where we have lunches, take breaks, and recharge and get ready for the next one. You can see we have our vision and our mission on the walls. We live these values every day, and so we have them everywhere where you can see them and make sure we're living those. And that concludes the tour.
Yes, my name is Robert Young. I'm 65 years old. I've met Dedicated at it was a gathering at the church, and I met they had a table set up, and I was just getting ready to turn 65 at that time, coming on Medicare. And the beautiful part about Dedicated, that for me, it was the fact that it was not far from my house on Hiawassee, the first center, and being able to not drive away from my neighborhood, I thought that was pretty cool. And then, when I got into finally signing up with Dedicated, I met my doctor, and it was the first time I felt in a long time having a doctor that really cared about me, and I could ask him questions. And it was really the fact that I know I was going to change a doctor anytime soon, because on my other providers, one day they didn't take the coverage I had, and I have to get a new doctor, and it's finding new people, and it was like, wow, I don't have to change my doctor, and that was really great. I love the fact that I didn't have to go to Quest, for example, for my labs. Everything was done on site. My medication, I left with my medication. I didn't have to, wait for a call that is at the pharmacy. So I love that about Dedicated. And here again, I think this is my first experience being on Medicare. So to find a company that really cares about seniors, I thought that was great. And on top of that, I've never been to a doctor so many times. I'm laughing because I thought, when you go to a doctor, once the sick come back 6 months, but I've been there so many times just to see my doctor and know that my health is good. I could talk to him about any changes that I'm seeing, and one of the issues was my prostate, and to talk to the doctor, what is it, what am I looking forward to? So once I got into Dedicated, I feel that they do care about my health, and of course the fact that you could go to a doctor and sit down and not rushed. I didn't feel rushed at all, and that's my experience. And now I'm at a new site, and I'm looking forward to continuing with Dedicated. Again, they are senior oriented. They love to take care of their seniors, and sometimes I guess people, when they saw me coming in, he can't be a senior, but I paid the price for 65 years. So I'm glad I'm Dedicated. I feel once you're here, they know you. They're very friendly, and I feel I'm in good hands. Other than that, again, the fact that I don't have to worry. And I think for some seniors, you have to, your transport, and even that they take care of. But I drive myself. But for that, I think knowing that you're in good hands, the center, when you walk in, you're screened. They make sure that while you're here, you're thinking if you need water, snack, whatever. They really try the best to make you feel at home while you're here. So I'm proud to be a part of Dedicated, and I hope the partnership will continue well into my 80s, 90s, hopefully. But right now I'm really content with Dedicated. Even the recruitment that they have, the way they approach us. I didn't feel pressured necessarily to come to Dedicated, but again, because of the community, I think that's so important that we could stay in our communities without driving, half an hour, 45 minutes just to get to a doctor's office. So with that in mind, I am so glad that I found Dedicated, and WellCare, under WellCare, I am covered. When I go to the doctor, again, I don't have to worry about, paying, you have to pay this, pay that, but everything is under one covering. I come in, I see my doctor. If I need a medication, like I said earlier, I leave with my medication. I don't have to stress that I have to wait for a week or a few days just to get my medication. So with that being said, I'm happy right now that I chose Dedicated. And I do hope that if you're considering, take a look. Come and see what Dedicated has to offer. And hopefully you'll be saying the same thing I'm saying going forward, that seniors are cared for at Dedicated. That's what they provide. And I think it's a good fit for seniors. So I trust that what I've said will encourage somebody to at least take a look, take a visit to Dedicated, and welcome home.
Welcome to another episode of Don't Ask, Don't Tell, the show that asks the questions that you should be asking but may not be asking, the show that brings you the information so that you can be enabled to make more informed decisions for both you and your family.